Hello and welcome to this episode of Chezuba Talks. Eosinophilic gastroenteritis, it's quite a mouthful, is a rare gastrointestinal disorder characterized by the presence of a high number of eosinophils. What are eosinophils? They are a type of white blood cell in the gastrointestinal tract. So, what is eosinophil associated disease? How is it diagnosed? Do individuals and families feel isolated when they have that? What kind of support do they require? Let's find out the answers to these questions and more from Mary Strobel. Mary Strobel is the Executive Director of American Partnership for Eosinophilic Disorders. Welcome to the podcast, Mary.
Thank you so much for having me. And you did a great job pronouncing eosinophilic. It's a tough one.
Yes, absolutely. So tell us, what is this disease and how is it diagnosed and what exactly happens in this?
Sure. So as you mentioned, eosinophils are a type of white blood cell. They play a part in our immune system, and they help us to fight off certain infections, parasitic infections, and they can also be involved in a number of other medical conditions like allergies, whether it's to food or to environmental. Um, Again, certain infections, certain cancers, and eosinophil associated conditions. Uh, they are named eosinophils because of the characteristic microscope. Stop. I'm going to skip over why they're called that. Start. Typically, eosinophils make up less than 5% of circulating white blood cells in healthy people, and that can vary over time. When a person has too many of eosinophils in their digestive system or tissues, organs, or their bloodstream without another known cause, it may be because of an eosinophil associated disease. And that diagnosis depends on where the eosinophils are found. So, for example, if they are in the gastrointestinal tract, we call those eosinophilic gastrointestinal disorders. It's an umbrella term. If they are in your esophagus, that is eosinophilic esophagitis. If it is in your lungs, sinuses, hearts, various organs, that is eosinophilic granulomatosis with polyangiitis. If it's in the lungs, it could be eosinophilic pneumonia. Hypereosinophilic syndromes could be blood or any organ. So again, these are characterized by where in the body they are found. And as such, there's not a single test to make diagnosis easy. So they are diagnosed through a combination of clinical evaluation, laboratory tests, and sometimes imaging studies and biopsies. Again, that specific approach depends on what the doctor may suspect is the condition. So typically diagnosis, it would start with medical history and a physical exam where the doctor will look at the patient's symptoms and their medical history or their family history of similar conditions. And that exam might reveal signs like skin rashes or respiratory distress or stomach pain. There's also measuring eosinophil counts in tissues, whether it's through nasal secretions or tissue biopsies. Imaging studies such as x-rays or CAT scans might be ordered. And again, the tissue biopsies are important because that will enable a pathologist to count how many eosinophils they might see within that tissue sample. And that can all help lead to a diagnosis.
Okay. So, difficult sounding disease and difficult disease to diagnose as well, and difficult to treat too?
Treatments vary depending on the condition. Here in the United States, there are some subsets of these conditions that have an approved indicated therapy for treatment. Other subsets do not. Oftentimes they're treated with corticosteroids. Some of the subsets, particularly in the GI tract, dietary therapy, avoiding certain foods, particularly common allergy causing foods, might help resolve symptoms. And then we have biologics that are also approved for some subsets of these conditions, including eosinophilic asthma, eosinophilic esophagitis, and EGPA, which is short for that long term I mentioned early, eosinophilic granulomatosis with polyangiitis. It's a lot easier to say EGPA.
To say EGPA, yes.
And hypereosinophilic syndromes. They have biologics that are indicated for treatment.
Correct. So, Mary, it is obvious that this requires a lot of support. This requires awareness, and that is why your nonprofit exists. So, please tell us, what are the programs that you have, and how do you support patients and families of patients who are diagnosed with this disease?
Sure. So APFED, which is the acronym that we use for American Partnership for Eosinophilic Disorders, we are a nonprofit advocacy organization that founded in 2001. And our mission focuses on 4 key areas: education, awareness, research, and advocacy. And we support those with various subsets of eosinophil disease, like I have described. And how we approach our mission is through a variety of different campaigns and materials. So for education resources and awareness campaigns, I'll start there. We provide comprehensive materials so that patients can learn, their loved ones can learn, a caregiver can learn about the condition and how best to manage it. And we do that through brochures and toolkits. We have webinars. We have a podcast series as well, and videos. All of those bring awareness along with education. And then we elevate the awareness among the general public, and we do that through events. We also provide doctors and clinics with resources that they can disseminate to patients in clinic. But public awareness campaigns also can help those among the public that may have symptoms of this condition and may not recognize it. I'll use one example: eosinophilic esophagitis, which is a subset that affects the tube that connects your mouth to the stomach. Patients that have that condition may have trouble swallowing. They may have food getting stuck in their throat, a food impaction. Sometimes that, stop. Patients with that condition can often experience difficulty swallowing, stomach pain, nausea, reflux that doesn't get better with medicine, or food impactions where food gets stuck in the throat, which is a medical emergency that would require a procedure to remove that stuck food. So an example of an awareness campaign was just recently, last month in May. We had launched in Times Square, New York City, on one of the digital billboards, a campaign that taught people, hey, if you experience symptoms like food getting stuck in the throat, reflux, this could be eosinophilic esophagitis, and have a conversation with your doctor about that. Oftentimes, people delay seeking care because they develop coping mechanisms. So, for example, if you're having difficulty swallowing, maybe you're eating smaller bites of food, or chewing, or taking a longer time to eat and really chewing the food to make it easier to get down your throat, or drinking a lot of water to help push the food down. So these are adaptive behaviors that people might not recognize, that these aren't normal eating conditions, and maybe I should bring this up to my doctor.
Right.
So in addition to educational and awareness campaigns, we maintain a strong online presence through our website and through our social media channels, I guess I should say. which really helps us disseminate information to a broader audience. We can help patients connect with one another and engage with each other. And our website, which has a wealth of information and resources, also includes a specialist finder so that patients can help find providers local to them for treatment. We have a very large online community, EOS Connection, on the Inspire network, and that's nearly 20,000 users around the globe that log in, they post questions, they give and receive support to one another. So it's really a great opportunity to network with other families that understand because they live this day to day. And finally, we organize annual conferences, which gives patients the opportunity to meet in person. There's also a virtual component to it, so they can log in remotely to learn about the latest in research and treatments and management strategies, but more importantly, to also network with one another. And that helps build a sense of community.
Absolutely. So obviously there is so much scope, there is so much of depth of research in this field. So it is but natural that you would want to stay updated. So one last question here, is it age specific or does it happen at all ages?
All ages can be affected by an eosinophilic disorder. We see some subsets that may be less common in pediatric patients, but for the most part, they can, or I should say, they do affect people of all ages.
Oh, okay. Well, I did say last question, but I have one more question for you.
Sure.
When you say people need to understand what is happening to them and when they should reach out for treatment. So what do you think is a threshold where a person should reach out and say, okay, I need to help. I need to approach, say, APFED. I need to approach a medical practitioner.
Well, I think anytime you have symptoms that are chronic, meaning they're recurring, absolutely bring that up to your doctor. There is information on our website, which is apfed.org, that describes each of these subsets and the symptoms that are often seen with these subsets. Some of them can be very vague symptoms, or they could be applicable to other medical conditions. So it's really important to work with the doctor to determine what is causing those symptoms, because the sooner that you have it diagnosed, the sooner you can start treatment and the sooner
Absolutely.
You can start to feel better.
Right. Well, I think thanks, Mary, for all your time and the focus on this disease. And I think if anybody wants to find out more, they could go to your website, which is apfed.org, I believe.
Yes, that is correct. APFED.org.
Right. And thank you very much for talking to us. Honestly, I did not know this existed, but today we are here to answer these questions and find out more.
Well, thank you so much for having me and for helping to share information about these conditions. You never know, one of your listeners may be struggling with symptoms, and
absolutely,
this would be something of interest to help drill down and find out what might be causing those symptoms. So thank you.
Right. Thank you. So the pursuit of knowledge is an ongoing journey, and every discussion we have on Chezuba Talks brings us one step closer to greater understanding and innovation, of course. Let's continue to ask the questions, explore new ideas, and support each other in our endeavors. Have a wonderful day, and I look forward to my next conversation with another wonderful change maker.